To begin my winter semester first year OSCE video, I'll just be beginning with a 360 of my room. So we have my desk, my floor, empty desk. This is where I'll be setting up my camera. The bed is empty. Here's my incision. Have my supplies here, and also I have my nurse practitioner's orders. Hello, my name is Cunningham and I'm a first year nursing student with the University of Windsor, and today I'm going to be demonstrating my final OSCE for the winter semester. Before I enter the patient's room, I'm going to want to be informed about the type of procedure that I'm going to be performing. So with the nurse practitioner's orders, I can see that it is a simple dressing change that I'm going to be performing. It's a daily dressing change, cleanse with normal saline, apply 2 gauze 4x4s and 1 abdominal pad, and secure with tape. And the patient also does not have any allergies due to this patient chart as well. Before I enter the patient's room as well, I'm going to want to ensure that I'm wearing professional attire. So I have my scrubs, I have my ID badge visible to the public, I have my hair off the back of my neck, my nails are short and clean, and I'm not wearing any jewelry. Once I enter the patient's room, I'm going to be closing the door behind me to create patient privacy. Once I enter the room, I'm going to introduce myself, what I'm doing here, obtain 2 patient identifiers, and also ask the patient how they would like to be addressed. So, hello, my name is Cunningham, and I'm a first year nursing student with the University of Windsor, and today I'm just going to be doing a dressing change for you. Could I please get your first and last name and date of birth? And once they give me that information, I'm going to check with either their hospital wristband or on the patient chart they have given me. And then I would also ask them, how would you like to be addressed today? Okay, perfect. After I have that information, I'm going to inform the patient about the procedure that we will be demonstrating today. I'll be receiving consent if the patient is okay with that procedure. I'll be asking them if they need to void before the procedure, and if they require any analgesics prior. So today I'm just going to be doing a simple dressing change. I'm just going to be removing the dressing you have right now. I'm going to be cleaning it with some saline, and then I'm going to be applying another dressing on top of that. Do you consent for me to complete this procedure with you? Great. And just before we get started, do you have to go to the bathroom before we do the procedure? And also, do you need any pain medication before we start? If the patient did inform me that they needed some analgesics, then I would be sure to administer those 30 to 15 minutes prior to the procedure. After I get all of that information down, I will be leaving the room to go and collect all of my supplies. I will be bringing all of my supplies back into the room. When I do so, I will be performing hand hygiene to help with patient safety. I will also be raising the bed to about hip level height to create a sterile field for myself. Because I do not have an actual hospital bed, I'm just going to be using my bed, which has to go a bit lower. And I will also be raising the bed rails, and I'll be putting the patient in a comfortable position, and then I'll be only removing the blanket over the places that we will be working with for the incision site. After I have all of that information down, I'm going to be creating my sterile field. So what I will be doing is I will be opening up my dressing tray away from me. Then I'll be getting the tweezers, and I'll be getting one of the drapings, opening it up, making sure that I do not shake it. And I will be placing it with the shiny side downwards. Then I will be putting the other draping underneath the patient. So I'll be asking the patient if they could please either roll over slightly, or if they could lift their leg up so that I can place the dressing underneath them. So just place that dressing downwards, lift the patient up, and then I'll place that in the sterile field and adjust with my fingers. place the patient back over top of the dressing. Now that I have my sterile field all set up, I'm going to be opening up all of my packages. So my abdominal pad, I will be opening that up, ensuring that I keep the sterile field. I will also be checking for the integrity of all of my supplies to see if there's any rips or tears, if there's any stains, and if all of the supplies that I have with me are in date. So then I'll be removing my abdominal pad from its packaging. And before I begin removing all of my supplies from its packaging, I will also be sure to get out my garbage bag. And I'll be placing this in between my patient and the sterile field. And I'll be opening it in a way that it will be easy for me to dispose of all of my supplies. There we go. Now I'll be disposing of my packaging. Then I'll be opening up my 4x4 gauze. And I'll be dropping all of my supplies 6 inches above the sterile field. Now that I have all of my dry gauze and pads open, I will be getting my solution ready. So we will just be using normal saline today, and I'll be filling up one of the wells of the cotton pads in my dressing tray. To however much I need, and then we would be moving on to removal of the dressing. So what would happen was I would properly don gloves. I would do any other PPE necessary before we begin the procedure. Then I would stabilize the skin and remove the tape surrounding the incision. And then I would remove the pad, the dressing, and I would assess if there is any drainage, if there is any color, or if there's any odor with the dressing. And then I would put that in between my hand, and I would properly doff my gloves and dispose of those. And then I would perform hand hygiene one more time for patient safety. And I would don new gloves until the hand sanitizer is completely dry, then don new gloves. And when I'm assessing with when I'm working with my patient, I would ensure that everything stays above the sterile field level, and if it drops below, then I would dispose of it and get a new utensil by either calling for another nurse or just probably calling for another nurse. Now what I'm going to do is I'm going to be cleaning my patient's wound. So I will be using my tweezers to get out my other pair of tweezers. And I will be wringing out my cotton balls that are soaked in saline, making sure to keep it over top of the well. And I will be beginning my cleaning of the wound in the middle of the wound, because it is the cleanest portion, because you usually would clean from dirty to you would clean from clean to dirty, and the center of the wound is the cleanest portion because it is the farthest away from the unsterile field. And before I begin cleaning, I would assess the wound, and I would state that it is a surgical incision with 10 staples. It is closed, and the peri-wound surrounding it has no arrhythmia, it has no callus, no maceration, and it has no induration. Then I can continue with cleaning my wound. So I will start within the middle of the wound because it is the cleanest. And I will dispose of that. Then I'll move on to the peri wound. One stripe down each side. And then I'll move on to the dry peri wound. Then I will be drying the wound as well, and I will be using gauze for this portion. Normally you would be using gauze for the whole thing, except because cotton balls are more likely to fall apart. But just for the sake of the video and the lack of supplies, I will just be performing it with cotton balls. So now I'll be drying the inside of the wound, starting at the middle. Then I'll be drying the peri wound. And then the dry peri wound. After we have the wound cleaned, we would then move on to assessing the wound. So if this was not a surgical incision, say if it was an open wound, you could also be, you would be assessing the wound bed for if there was any necrosis, if there was any slough or epithelialization or granulization. And you would also be then assessing if there was any exulant, and if the exulant was serious, serious sanguineous, or if there was purulent, or if there was any odor present. Then after you have that information, you will be moving on to measuring the wound. So today we will just be measuring using measuring the length of the wound, but you could also be measuring the width of the wound. You could be measuring if there was any tunneling or the depth of the wound. So I'll be using this Q-tip. But normally this wound is a little bit enlarged because of the photo that I have printed, but normally it would be a little bit smaller for the normal OSCE. But with assessing this wound, I can confirm that this wound is roughly 17 centimeters. Then we'll be disposing of this properly. This would also be a perfect time that if we needed a sensitivity culture, we would be gathering this now with the wound clean. So you would be you'd be going in at a 90-degree angle into a non-contaminated area and assessing that way. But since we do not need that, we will not be performing that today. And then now that we have all of that information done, we will then be moving on to dressing the wound. So we'll be getting our tweezers and placing our 4x4s on top of the wound, making sure that we do not break sterile field. Normally, the 4x4s would cover the full wound, but just due to the size of mine, it will not completely cover. And then we will use my abdominal pad, place it over top. And because the top of the abdominal pad or the blue line is not in within sterile field, I'm allowed to touch the top of it, ensure that it is flat. Then I'll be using tape to secure the dressing. And I will also be using one piece of tape that is labeled with the date, the time, and my initials on top of it. I will be placing that one piece of tape with the date, time, and my initials on top of the wound so that other healthcare professionals will know more information about the wound. So after I'm done fully dressing the wound, then this would be the perfect time for me to be cleaning up the area, doffing my gloves, performing proper hand hygiene. I would be moving the patient's bed back into a comfortable position. I would be covering the patient back up with the blanket to create patient privacy and patient dignity. And I would also be using this time to ask the patient if they have any questions. So do you have any questions to me today before I head out? And this would also be a good time to be giving some patient education. So just for your knowledge, if you were to increase your amount of zinc, vitamin C, and protein into your diet, it would help promote healing of your wound. And after, the next step of the patient care would be to document using the DAR template. So first I would begin with data. So data, this is a closed surgical incision with 10 staples in it. There was no odor, no peri-wound issues, and there was no discharge or anything like that, or no drainage, and the color was normal. And then you would move on to action. So I performed a simple wound care. I performed a simple wound dressing on my patient, and I also used some patient health care learning. And then finally, for response, the patient required no analgesics prior to the assessment, and they tolerated the procedure well throughout the whole entire thing. And after I have my whole station up, I'm good to move on from this. So thank you. That concludes my OSCE for today.